We've got a very vulnerable population in aged care and they need protection. However, we've got to balance the risks, because the risk of totally locking down aged care institutions means that people can't visit their parents, that partners can't see one another, that people who are potentially going to be very distressed if they're not kept in a constant sort of pattern are going to suffer. So there's a risk there. And I think I agree with the comments of the Chief Health Officer. It would be inhuman to have a complete shutdown. So we'd support not doing that. But we do also support a measured, well thought through set of conditions that people have to comply with to protect people in residential care.
You're getting more briefings than most of us in terms of what elderly people in this country should be doing. There are concerns that grandparents should start to have some distance between them and their grandchildren. Is that something you think is advice worth following?
Look, I think that's a conversation that has to be held, and I know people who are doing that and talking it through with their children. I think it can be difficult in some cases where the parents are actually at work, particularly say if they're in healthcare or aged care, and they do need that sort of help and they can't afford to do other ways. That's a difficult conversation. I think it's one that has to be had and talked through, and potentially to protect the vulnerable older people so that they don't become carriers of this terrible disease.
We've seen the measures taken by Coles and Woolworths to allow elderly Australians to have the shops to themselves essentially for the first trading hour of the day. Have they been broadly working? We've seen some criticism. Are they useful, or do we need another plan to ensure older Australians have the supplies they need?
Well, look, we were very excited when we heard Woolworths and then Coles and then others saying they'd do this. It was very disappointing, however, when they didn't have the stock on the shelves, or didn't have enough in some cases. And I think we've got to get that working as well, the logistics. Now, on the other side of it, it is terrible that people are bulk buying things that they don't necessarily need. Something has to be done about that. It's not good enough to say, don't do it. That isn't working. So we saw lots of people going into shops yesterday and today who haven't been able to purchase natural necessities of life because they've been taken off by others. So I think we have to do something more seriously about this.
Yeah, and we can only hope that Australians heed the message, a very strong message from the Prime Minister on that front this morning. Professor John McCallum, appreciate you joining us.
Thank you very much.